Welcome to the Montel Williams Show!
Hello folks, welcome back to the Montel Williams Show. I am here with a person with type 1 diabetes. Here is Mr. Rufus Albert. Rufus, I'm going to interview a little bit to let the audience know, as well as the viewers, a little bit more about type 1 diabetes and how it can be caused and things like that. So, can you tell me the symptoms of type 1 diabetes?
Well, first I would just like to say thanks for having me on your show. It's really great to have an opportunity to show people and help them relate to what my disorder is like. Type 1 diabetes is a hereditary disease that is brought on in children, and it is a disease where the immune system thinks that the insulin-producing cells are bad, and so it kills them, and it keeps your pancreas from producing the needed insulin to allow glucose, most of you would call that sugar, into your body cells. And that makes you not have sugar in your cells.
Okay, well, could you tell me a few symptoms? Like, how would you know that you had type 1 diabetes?
Well, luckily, there's no pain or anything like that. The most common symptoms are just fatigue, weight loss, blurred vision, and high blood sugar.
Okay, the short-term effects of diabetes, I'm not really sure what they are. Could you better explain?
Just rapid heart beating, sweating, paleness of your skin, anxiety, being sleepy, confusion, headaches, and little things like that.
Okay, so if I understood you right, you have high blood sugar because your body does not produce insulin to break down it. Am I correct?
That is correct.
Okay, so if you don't have enough insulin, am I right? You have to take medicine, and what can this cause?
Not taking the medicine causes things, high blood pressure, and then it makes things like abdominal pain, weight loss, cold skin, more confusion, weakness, blurry vision, and frequent urination.
Okay, and I'm aware from my previous knowledge that this is not too much of a life-threatening disease, yet it is kind of an annoyance throughout your life that you have to take a lot of precautions on. Could you tell me a little bit about more of the in-depth long-term effects of?
Diabetes in general reduces your lifespan 5 to 8 years. There are heart complications that can end up happening when you become older. Your arteries start to harden from the lack of sugar, and kidneys, nerves, and eyes start to become damaged.
Okay, thank you for that information, and we're getting near the end of this little segment, or interview, shall I say. Just a couple more questions. What are the treatment options? Like, is there any way to completely get rid of diabetes?
Well, there are medicines with insulin in them that help the body with blood glucose level. It helps your sugar go into your cells because the natural producing insulin doesn't work in your body, and that helps you keep low sugar. Healthy diets, working out a lot, staying fit, watching what your food and testing your daily sugar levels is very important to make sure that you're always on top of your condition.
Alright, and one last question before we have to take a break here. You said this is hereditary, so is there any type of prevention or?
Unfortunately, there's not much you can do besides maintaining things day to day. You can't keep yourself from getting the disease because it's completely hereditary and just passed on from your parents.
So there you heard it, people, from somebody who knows it firsthand. It's come about time to a close. We're going to have to take a break right now. Next, we will be talking to a patient that has schizophrenia. Welcome back to the Montel Williams Show. We are here with our next guest.
Hello! Thank you, Montel.